You know, in the history of medicine, there are these moments that just change everything. Think about it. Before anesthesia and after. Before antibiotics and after. Well, today, we're looking at one of those moments, and it's powered by a machine that has totally rewritten the rule book for the operating room.
I mean, just think about that for a second. It sounds like something straight out of science fiction, right? You've got the surgeon on one side of the room, the patient on the other, and they're connected by this quiet, incredibly precise machine. How is that even possible? That's the puzzle we're going to unpack.
And it's called the Da Vinci Surgical System. Yeah, that Da Vinci. A name that just screams genius and invention. And now it's attached to one of the most sophisticated tools humanity has ever created.
All right, so let's dive in. Here's our plan for today. First, we're going to look at the impossible dream that started it all. Then we'll get into the anatomy of a superpower to see how it works. After that, we'll see how it's completely rewritten surgery for millions. We'll also get into the controversy, the robot in question, and finally, we'll peek into the next frontier.
You know, every great invention really starts with a problem. And for centuries, the problem with surgery was that the cure often felt just as brutal as the disease. The old philosophy was kind of grim but simple. Bigger problem, bigger cut.
And this right here shows you the huge shift in thinking. The old way meant big, open incisions, a lot of trauma to the body, and weeks of painful recovery. The new dream was, what if we could operate through tiny keyholes instead of big doorways? What if we could work inside the body with the least amount of damage possible?
But what's really wild is where this idea came from. You'd think a hospital, right? Nope, the Pentagon. Back in the 80s, DARPA, the military's research agency, was trying to figure out how to let surgeons operate on wounded soldiers from far away, basically a battlefield robot. Now, that specific military project didn't happen, but the technology found a new life in Silicon Valley, and that's how it eventually became the Da Vinci.
So how does this thing actually work? Let's get into the guts of the machine itself. Because the Da Vinci isn't just a robot. It's a whole system built to give surgeons abilities that are, well, beyond what any human body can do on its own.
Its first superpower is something called motion scaling. Think about it like this. The surgeon sits at a console and makes a normal, comfortable movement with their hands, maybe moving them an inch. But inside the patient, the tiny robotic instrument makes a perfectly corresponding move of just a millimeter. It literally translates human-sized movements into microscopic action.
And then there's what I call the tremor killer. Every single human hand, even the steadiest, most experienced surgeon's hand, has a natural, tiny tremor. It's just part of being human. The Da Vinci system completely filters that out, so the surgeon's intention gets through, but the shake doesn't. What you get is perfect, unwavering steadiness.
And when you put all this together, you get something that's basically superhuman. The surgeon is looking at the operating area in magnified, high-def 3D. The instruments are tiny, smaller than a pencil. And they have 7 degrees of freedom, which means they can bend and rotate in ways your wrist just physically can't, especially when it's deep inside the body.
And that really is the key. As Dr. Catherine Moore from Intuitive Surgical puts it, these instruments become the surgeon's new wrist inside the patient. And honestly, they're an upgrade. They can get to angles and make moves that are just impossible for our own flesh and bone.
Okay, so the tech is incredible, no doubt about it. But what does it all actually mean for the person lying on the operating table? This is where the whole revolution gets really, really personal. The sheer scale of this is just staggering. Since it got approved back in 2000, we're talking about over 12 million procedures done with the Da Vinci system. This isn't some niche experimental tech anymore. In a lot of fields, it's become the global standard of care. So, what's the payoff for the patient? Let's just take prostate surgery, a very common procedure. With the traditional open method, you're likely in the hospital for 4 or more days. With the Da Vinci, most patients go home the next day. I mean, look at that difference. It's dramatic.
You know, numbers on a chart are one thing, but hearing it from a patient, that just makes it all real. This quote says it all, doesn't it? Less pain, a tiny fraction of the recovery time, and getting back to your normal life way faster. For so many people, that's everything.
Okay, but the story of the Da Vinci isn't all sunshine and roses. Like any technology that completely shakes things up, its rise has sparked some really intense debate and criticism inside the medical world.
So it's really important to look at both sides of the coin here. On the one hand, you have all the praise. The precision is just unheard of, it's minimally invasive, and recovery is so much faster. But on the other hand, the criticisms are serious.
It has a very steep learning curve for surgeons. It costs a ton, about $2 million per machine, and some doctors question if it's really necessary for every procedure it's used for. And this quote from a surgeon really gets to the heart of that learning curve problem. It takes a long time to get truly good at the console, and during that learning period, well, there are real questions about whether the patient outcomes are as good. It's a huge challenge, and it's led to a need for really tough training programs.
So where do we go from here? The Da Vinci robot we see in hospitals today is probably just the beginning. I mean, the next frontier of this technology is already taking shape in labs around the world.
We can already see the evolution happening. Today, there are systems like Ion that can snake through the natural pathways of your lungs to find a tumor without making a single cut. Tomorrow, we're talking about micro-robots that could literally travel through your bloodstream. And the future? That's where AI comes in, guiding a surgeon's tools, or maybe even doing some tasks like perfectly suturing a wound all on its own.
With all this tech, it's really easy to think that surgery is becoming cold and impersonal. But a lot of surgeons say it's the exact opposite. This quote really captures that idea, that by giving them better tools, a better view, the machine actually deepens the connection and the level of care they can provide. And that leaves us with one last huge question to think about. The Da Vinci gave human hands superhuman abilities. The next generation is going to mix in artificial intelligence. So, as these tools get smarter and more capable, the very definition of what it means to be a surgeon, well, that's going to be rewritten all over again.